If you have a headache and you're having that 2-3 times a week, that's getting in the way in your concentration, your ability to work, your ability to provide as a mother or a father,
Yep.
your ability to be a good spouse, because like it's a very personal pain, I feel like,
Yeah.
especially, and then it's affecting the way they eat, and you can't enjoy a meal with friends.
Yeah.
Like we always talk about, what's your why? You're not coming to see me because you're in pain. You guys are tough. Like, you're fine. Right? You
Right.
can get through it.
Yeah.
But it's affecting your ability to live the life that you desire.
Welcome to the Movement Driven Podcast with Dr. Greg Goldberger, where we help you bridge the gap between pain and performance. Each week, we'll share strategies, insights, and real-life applications to help you keep moving and stay driven. Now, let's get into this week's episode of the Movement Driven Podcast. Hello, everyone. Welcome back to the Movement Driven Podcast. My name's Dara. I'm here with Dr. Greg. Greg, how you doing today?
I'm doing well, Dara. How are you?
Doing good. You know, it was wild. When I woke up this morning, had a little bit of a headache, and it just kind of reminded me of like back in the day when I used to get really bad migraines, specifically after I had a really bad concussion when I was in college. And, you know, I don't really struggle with that anymore. There's been some things that I've worked on and some, things that I do, but I always get a little bit nervous when I have a headache. So today I kind of want to talk about headaches and migraines and, maybe what that missing link is that, people can either do movement wise or, things like that to kind of help get rid of, or at least, alleviate those headaches and migraines.
Reduce the frequency of.
Yes. So can you talk to me a little bit about, I guess just like what, as a PT perspective, like what is a headache really? What is it doing? Like and migraines and things like that.
Yeah. Well, obviously, it's a good question. I think obviously headaches, if we just put it in general standpoint, can come from a multitude of reasons, right? Like even migraines, they're still kind of figuring out what causes migraines. And I think it's different for everybody. There's hormonal things. I know my wife has, there's certain times of the month or with her diet changes, she's going to have a migraine just because her hormones are different at that time. But they're really saying it's more of a blood flow to the brain issue. Now, if we talk about a blood flow to the brain issue, then we can talk about things like posture and how that influences, how we're getting certain lymphatics or if there's a fascial component, not allowing things to migrate, or even just poor posture, kind of limiting how vessels are flowing really well. So that's still for debate. I think there's also some argument that there's like C2, C3 nerve irritation that can cause migraines, and that can be posture. If we get that forward head coming forward, we still have to look up and function in society. And when we do that, we get a narrowing of this suboccipital area, which is at the top or the base of the skull, at the top of the neck. When things start to get compressed, we're going to lead to compression of potentially nerves, which can refer patterns of pain upwards. So migraines are a little bit more hit or miss in terms of if physical therapy and posture improvement and strength improvement can have a real effect on that. But when we talk about headaches, one of the main headaches that I think most people get are tension headaches. And so that's usually described as a ram's horn headache. So it's starting in the base of the neck, similar to what we were just talking about. And it's coming over, and like me, I feel mine right over the eyes, right? We have sinus headaches. That's another topic. We have stress induced or if something's wrong with your vision, obviously that can induce headaches. But I think most of the time, especially at the end of the day, or if we're in a poor posture, we're going to have tension headaches over the eyes. And that absolutely can have physical therapy can have impact positively on reducing the frequency of and the intensity of tension headaches. So I think that's where we have the biggest impact for sure. And a lot of that is just kind of similar to what we talked about in our last episode, is posture can have a really big effect. And so what are we doing to improve our posture throughout the day, or our sleeping postures to reduce that musculoskeletal tightness that leads to that tension?
Yeah. And I know that we've, talked kind of briefly about TMJ, which is, in the jaw and tension in there. But how does that kind of flow into the headache and migraine situation?
I think it kind of fits more with like the neck pain patient. So there's often TMJ, for those who don't know, that's your temporomandibular joint. So that's your joint right here, your jaw joint, and that's the one moving when you're chewing and talking. And so when you have TMJ disorder or TMJ dysfunction, there's basically an injury to the disc, and that there's a little disc that sits in there and it has to move. And And sometimes we get tension throughout the muscular system or injury to the disc itself, and then that joint isn't moving the way that it's designed to. So we get the clicking, the popping, and the pain and all that kind of stuff. Now, what I will say is I have never seen somebody that has TMJ that doesn't also have a neck issue. They go hand in hand. And a lot of that is postural. When we get to certain tension on certain areas, the body is going to compensate, and the jaw is no different than, just like I have people with knee pain that have hip issues, right? You've talked about that with your thing where your root cause is at your hip, but your pain is in your knee.
Right.
Well, if you have pain in your jaw, chances are the root cause might be somewhere in the neck or in the posture. And so how that relates to headaches is a lot of the time just pain there. Obviously, tension there can cause temporal headaches. But if you're having neck as your main source causing TMJ disorder, then the neck pain is also causing tension headaches. So I feel like people with TMJ disorder often have neck issues. Therefore, they also have headache issues.
Yeah.
So the root cause is all posture.
Yeah, no, that's interesting. And so I know obviously TMJ is its own thing, but does this also get caused by, I am I grind my teeth at night. I have to wear a mouth guard. So I could establish TMJ because of that, or
I would say that's probably the main thing that, like, if you went to a dentist, they're gonna say you're grinding your teeth at night, and or you're a gum chewer, or maybe you're just holding tension there for whatever reason. Maybe it is partially because of your neck issue to begin with. But those of us, I grind as well. I need to wear a night guard. That's going to be the main thing, because you're just moving your jaw back and forth, and you're putting stress on these two. I mean, the two joints kind of move in conjunction with one another, because you only got one jaw. And so that's moving an emotion that's not prepared to do. So when you're clenching all night long, you're also activating your masseter muscle and your temporalis muscle, which are your main two muscles of mastication, i.e. chewing. So it's basically like you're just chewing all night. Imagine if you chewed gum all day, you'd be sore, like not necessarily like painful, but you'd be tired. Like that's a workout for your jaw. And so it's a lot of stress into a joint. So just like any other musculoskeletal issue, you can overload a joint or compensate for a neck issue, and that's going to lead to TMJ disorder or dysfunction.
Yeah, yeah. So, if for just, a blanket tips or just suggestions for those folks who might be struggling with this, what are some things that if someone were to just come to you day one eval, what are the things that you're going to ask them? And then, kind of going from there of like what you might recommend for them.
Yeah, so we're obviously we want to delineate what type of headache you have. If you haven't seen a neurologist, or you haven't really talked to your doctor, and we're kind of the first people you're coming to address this, we want to make sure that it's not a migraine, or it's not sinus headaches, and it's something that we can actually have a true impact. And migraines, I think we do have dry needling has shown, like, I've had a few patients that have reported way less migraines from doing some of the same things I'm treating my TMJ patients with and my tension headache patients with. But obviously we do a full postural assessment. I want to look at the way you're sitting, look at the way you're walking, look at the way you're standing, look at the way you're moving your upper body, or even the way that you're doing functional squats. And how is that chain reacting to those movements? But I think the first course of action, other than postural re-education and strengthening those muscles and increasing endurance of those muscles to keep you in that sustained posture, usually at the beginning, we're doing a lot of manual therapy with these patients. We're doing a lot of deep soft tissue and mobilization. We're doing a lot of trigger point release, and a lot of dry needling, like I said, has been game changer. I had one patient who he actually came to me for hip and knee pain, solved that. And then he's like, I have TMJ disorder. My dentist is referring me to all these specialists. They say I should get surgery. Can we try to do some stuff before I go that route? I was like, absolutely, let's do it. And for him, it was 100% his posture 101. But he, just with like 2 or 3 sessions of us starting to address it, he had pain decrease or disappear that he had basically since adolescence, his whole adult life.
Wow.
He was having TMJ pain, and he's in his late 40s. And a few sessions in, and it's a game changer. Now he sees me on kind of like a maintenance routine where we needle every 3 months or so, and he comes in and I have him on an exercise program. A lot of it is kind of addressing his postural issues, and he's doing really well. So I think it's something that a lot of patients don't even know that physical therapy can have an impact. It's usually like night guard, and that's all we got for you from your dentist.
Yeah.
So, I hope dentists will start to kind of refer to people like us. But yeah, if you're at home and you've had headaches and neck pain and jaw pain, there's answers for that. And it might be as simple as just some good manual therapy and some dry needling and the right exercises into your program.
Yeah. No, that's wild how that can all work. But I mean, the human body is such an interesting thing,
It is.
and it's really cool to know that we can put that information out there for our listeners, and for any potential patients that might come in.
Sure.
So I think that we can go ahead and wrap up on this one. A little shorty today, but that's okay because there's a lot of good, useful information and education in this episode that we talked about. So if you're in the Jacksonville area and you're struggling with TMJ or headaches or migraines and things like that, you can go to our website, movementdriven.com, have a discovery call with Dr. Greg, talk a little bit about direction, and maybe if this is your first step, maybe we can help point you in the right direction of where one step should be. But we'd love to help you out and see if we can help with that pain to go away by manual therapy or dry needling.
Yeah, and I'll just add, this is something I actually rather enjoy treating because it is something that can be so debilitating. Like, think about if you have a headache and you're having that 2-3 times a week, that's getting in the way in your concentration, your ability to work, your ability to provide as a mother or a father, your ability to be a good spouse, because like it's very, I don't know if intimate's the right word. It's a very personal pain, I feel like, especially, and then it's affecting the way they eat, and you can't enjoy a meal with friends. Like we always talk about, what's your why? You're not coming to see me because you're in pain. You guys are tough. Like, you're fine. Right? You can get through it.
Yeah.
But it's affecting your ability to live the life that you desire.
Yeah.
And so I love doing manual therapy, and I love doing dry needling because it's had such an impact on people. So yeah, like we said, if you are in this area, come in, do just one eval with us. Let us do some treatment on you and see if it's a game changer.
Yeah.
You never know.
Yeah, absolutely. Well, thank you so much, Dr. Greg. This is a great episode, and we'll see you on the next one.
See you guys.
Thanks for tuning in to the Movement Driven Podcast with Dr. Greg Goldberger. Want to see how we're helping people in Jacksonville bridge the gap between pain and performance? Head on over to movementdriven.com. Until next time, keep moving, stay driven.